your personal hygiene has to be at the utmost best level. That way you are not, you know, you can't get infected by this. Aches and pains. Is this something that you would put under non-communicable illnesses? Like, this would obviously fall, it's a symptom that would fall under, would this usually come under that category?
Yeah, definitely, as you very correctly told, it's not an illness or disease as such, it's a symptom. It may be the symptoms, the commonest symptoms people have. Everybody is having aches and pains. There's nobody that who has not got aches and pains in day-to-day life. So when it comes to a sort of a unbearable pain or a recurrent pain, then you need to address it.
Now I know the number one solution for a lot of people that I know, paracetamol is the key for them when they have aches or pains or other OTC drugs. Is this right, what they do when they feel, oh, you know what, I have a pain in my leg, let me just get a paracetamol, and they go back to their day-to-day living?
Yeah, it's not a bad thing to do. Simple paracetamol is very helpful. It's available over the counter and it's used worldwide. You can always use paracetamol for aches and pains, headaches. That's advisable. But what is important is, if you are getting recurrent pains, if you are getting very severe pains, if your pain doesn't respond to paracetamol, yes, then you have to consult your doctor. It may be a warning sign of a serious underlying illness. You never know.
Now, like you mentioned again, personal hygiene is a must when it comes to anything, like if you're prone to like getting illnesses or whatnot. What lifestyle changes would, apart from personal hygiene, lifestyle changes would you suggest to people at home that they should start doing?
Yeah, lifestyle modification means a lot. It comes from the dietary advices to the day-to-day exercises, and also to have good mental health, stressless life.
Okay, now getting into the deeper into this now, you said exercise. How much of exercise should a regular person, now you get your gym fanatics, you get your regular people that jog every day, and you get the people that don't work out at all. What is the minimum amount, or you think the most healthy way to just work out? Maybe, what is it, 1 hour a day?
Yeah, healthy exercise means at least you have to do 30 to 40 minutes of exercise every day. You can go up to 1 hour. But that doesn't mean that you have to do very vigorous exercises. The healthy exercise means you have to have sort of a stretching exercise at the beginning for a few minutes, and then warm up a little bit, and then go for the proper exercise. Proper exercise means you have to achieve your what is called the target heart rate. You can calculate your target heart rate very easily, for that you need to have your own maximum heart rate. Everybody has maximum heart rate to achieve. So maximum heart rate is 220 minus your age. Suppose you are 40 years of age, then 220 minus 40 means 180. If you take 70 to 80% of your that value, that gives you a target heart rate. The target heart rate is the one which you have to achieve while doing exercise, not the maximum heart rate. So you have to maintain that target heart rate for at least 15 minutes at the peak exercise, and then gradually come down.
So it's obviously advisable here on Good Morning Sri Lanka that we advise you to have a heart monitor when you're working out.
That's ideal. if you have a gym, that's the ideal place to do your exercise. Good that you have walking tracks, you can walk there. Of course, nowadays we have these attached
to your wrist. Usually it's on your wrist
or your waist. You can attach your heart rate monitor and walk. But safety must be the first. Some people walk in unnecessary places, they get into trouble, they get robbed. Sometimes the dogs comes and bite them. So the safety is the number one. And
so gym, just go to the gym on the treadmill.
But if you have nicely done walking track, safety there, lights there, people are there, so you can walk nicely. But select your shoes and also the path you are walking, because hard surfaces you have to avoid. You should not walk on the tarred road. You should walk either in the sand or the grasses with the good shoes.
Of course, that is very correct. But you know, I've actually started walking again. I walk down, there's great areas in Sri Lanka now that you could just walk. Great kilometers.
You start getting pains here and there, knees and
I can't walk straight now because I haven't jogged in a while. Alright, now diet. You mentioned diet. a lot of people, if you Google diet, you would see different methods of having your food. Some people would eat 5 times a day, like very small portions. Is that healthy at all? Some people would eat big amount of food, like as a lot of Sri Lankans might let you know that they eat rice. Now they eat rice in a very different way. They eat more rice than they actually eat curry, which is why we tend to, a majority of people tend to lose and go overweight at times. What is your average diet that you think would help anyone that even working out, or if they're a regular person just going to work every day?
Yeah. These are very important questions. Everybody is confused about this diet. You know, if you have a special illness, yes, you have to get your advice from your doctor and the dietitian.
Yeah.
Otherwise, for a normal, ordinary person, 3 meals a day would be okay, but in between you can have small 2 meals. So it's a 5-meal concept in that sense, but if it is a 5-meal concept, you should avoid 3 large meals also. Yes.
Right.
3 large meals always. So you have to make a very balanced, nutritious diet.
Right.
That is the key. And on the other hand, you should have some idea about the calorie intake and your body weight. So if you want to lose your body weight, then you have to reduce your calorie intake.
That's right.
By adjusting your diet. So you should have a rough idea about your what is called the body mass index. You can calculate the body mass index by dividing the weight in kilos. Divide the weight in kilos by square meter of your height.
Right.
So suppose your weight is 70 kilos, you divide 70 kilos by square meter of your height.
Right. So this is a very basic formula that you could
very
use
basic formula. The normal range is 18.5 to 25.
Okay.
For the Asians, the average is around 22, 23.
Right.
So if you are above 25, you are overweight. Then you have to cut down your weight. So then you have to make your diet in such a way that you will lose your weight. So you reduce your calorie requirement. Average ordinary person 70 kilos will require about 1,800 calories a day.
Right.
Right. So if you are taking more than that, you keep on putting weight.
Putting weight.
Yes.
That makes complete sense. So this actually is a very good thing brought up, Doctor, is that whenever you go into a supermarket from now on, make sure you read that container, what it says on the side.
Yes.
That way you would know how much exactly you'll be taking in your body and what exactly you would need.
And the important fact about diet is that you have to always have a balanced diet. As I told at the beginning, it should be nutritious. You know, majority of our energy comes from carbohydrate, which should be around 50% of your diet, carbohydrate, and then about 30% from the should be protein,
right,
which you can get from fish or meat or green grams or other cereals, and then the 20% from fat.
Right.
That's the lowest. So we have to talk about the quality of foods as well. So when it comes to carbohydrates, if you are eating very fast foods like refined processed foods, then you are going into trouble.
Okay.
Because you don't give your body to work on these. They just get absorbed.
Right.
But if you have a complex carbohydrate fiber diet, when you take your carbohydrate load, then your body need to work on it, digest it, and it will gradually give you the required energy.
Right.
And the fiber is also important for you to give your body, because that will prevent some cancer in your gut.
Right.
So when you select carbohydrate, select complex carbohydrates.
Right.
Right. If you talk about rice, brown rice is better than white rice.
Right.
Similarly, anything white in food, not good.
Keep that to a minimum. Here on Good Morning Sri Lanka, we advise you to go brown, like brown bread. That's a very good one as well. On that note, Doctor,
and also the fruits and vegetables.
Okay.
Colorful fruits and vegetables.
Okay.
That gives you additional nutrients and antioxidants.
Right. So we'll get into detail about that in a quick bit. But we'll go into a quick commercial break, and we'll be right back here on Good Morning Sri Lanka.